Hi, welcome back. Today we are going to see the top 20 Neuro Nclex traps student where they miss often. So let's go. It is about the important topic, that is the stroke, and where we are going to miss is about the increased intracranial pressure traps. Here the points which we should monitor is giving food before swallowing screening. So we have to first assess the patient's swallowing ability before we are going to administer the food or any drinks, mainly to prevent the patient from aspiration risk. And the second point is not recognizing the sudden loss of consciousness changes, and it is an emergency. So we have to see any changes in the loss of consciousness and create an emergency. And the third point is lowering the head of the patient flat in increased ICP. So this is again a nearest danger for the patient, because this can cause still increased ICP and the patient might go into severe emergency condition. And the fourth one is allowing neck flexion or hip flexion. This is again going to cause the increased ICP. And the fifth one is ignoring restlessness, an early sign of ICP sign. So this has to be monitored very early, and treating the headache as pain problem instead of neuro deterioration. So we have to see the headache. It is not a pain problem. There might be some pathophysiology being hidden behind that headache. And the last one is the forgetting the hemorrhagic stroke, and where high BP is allowed. It is allowed only with caution. So these are the important traps in stroke and ICP. And the next one is the meningitis traps. Here we are going to see, always we often wait for the lab confirmation before starting any precautions. That is false. We have to first isolate the patient, and we have to protect the patient and the environment and the staff. So we have to isolate the patient, and we should never forget the droplet precautions. So the droplet precautions has to be implemented very immediately. And the next one is the seizure traps. Here we are trying to restrain the patient when the patient is having a seizure. That is a bad option. And again another thing is we are putting some object in the mouth, and again this is a bad choice. Forgetting side lying position. So these are all false things we should never follow. And next one is not checking the airway after the airway seizure has ceased. So once the seizure has stopped, we have to assess the airway of the patient. And we should never give any oral medications immediately in the post-ictal phase. We have to first assess the airway condition and the swallowing capacity, then only we have to administer any type of medications. And the spinal cord injury traps, here what we are going to miss is, this is manifested by increased blood pressure and headache. So we have to see these signs, and we have to get some picture in the mind about the autonomic dysreflexia, and we have to treat it appropriately. And lying the patient flat during an autonomic dysreflexia, we have to avoid this, and we have to allow the patient to sit up. And the next one is the neuromuscular traps. We are often ignoring the respiratory monitoring in a Guillain-Barré syndrome, but this is a trap. We have to always first emphasize on airway, because it is an ascending airway disease where the respiratory muscles are being involved. So the patient might have a problem with the respiratory. So we have to see this. And next one is focusing on limb weakness more instead of the breathing effort. So it is wrong. So we have to see first the breathing effort of the patient, then only we are going to focus the other weaknesses of the limb. And the final general neuro trap, or we are always getting stuck, is we are focusing on the diagnosis of the patient instead of the neuro changes which is happening actually in the patients. So we have to see what are the neuro changes which is happening with the patient. Is he having loss of consciousness? Is he having increased BP? All these things has to be monitored. And we are treating the abnormal pupils and new weaknesses as a routine finding. No, this is not a routine finding. This is an emergency. This is an alarm of some impending danger in near future. So these all things has to be monitored and observed appropriately. When the question are saying such type of traps, we have to get attention on such type of question and options, and we have to solve the answer in a correct way. So this is all about today's topic. Thank you and happy learning.